we've seen a lot of theory. And so what we want to know is, does it really happen in real life? Can we take these ideas and take this principle and apply it to people? And so let's just look at some children, some pediatric cases just to begin with, because we know that children are going through active growth and development. And the idea is, can we harness that growth and development as the development proceeds? And the short answer is, I think we can. So here's a young child, and what we can see, these are baby teeth. And what we see in these baby teeth is that there's a crossbite on this side here. And a crossbite means that the teeth are not biting in the normal relationship. And so what that tells us is that this top jaw is not wide enough, okay? Because if the jaw was wide enough, those teeth would be over the bite on this side here instead of being inside the bite like they are here. Now, this is a child who's about 5.5 years old, not even 6 years old yet, so it's a young child. And by wearing the appliance for about 3 months, okay, what we can see is the top teeth, the permanent teeth, have come through, and that this bite relationship has been corrected. Now, what's the big deal here? Well, I guess the deal is that this was done completely without braces, and also it was completely pain-free. This child wore the appliance in the late afternoon, in the early evening, and at nighttime when they're sleeping, but not during the day. And so it's a procedure which is comfortable for the children, and no one needs to know that you have this appliance in the mouth. And what we see here is a little bit of spacing. Well, that spacing is a good thing, because what we know is that when you have baby teeth in this position, biomimetically, we should start getting spacing here before the permanent teeth come in, because the adult teeth are larger than the baby teeth. And so if you don't have spaces, like here there's not a lot of space here, if you don't have spaces in the deciduous or the baby teeth and the milk teeth, it means that the jaw is too small, and it means that the adult teeth are going to be crowded, they're going to be irregular when they come through. And we see here spacing appearing. Okay, so this is a biomimetic approach. Is there any further evidence to say that this is a biomimetic approach? Let's look at this child, and here she is. And this is what she looked like before the treatment was done. And she's a cute-looking kid, and you're thinking this is totally fine, which it is. But what we do see is there's a bit of a head rotation. The head is kind of rotated, kind of in a counter or anti-clockwise direction. And then look at her shoulder here and her shoulder here. This is before she had the treatment. And here she is 3 months later. Her head seems to be slightly more straight. And if you ask me, those shoulders are kind of more level than they were originally. Remember, we talked about a top-down procedure. We get the top jaw corrected, we get the bottom jaw corrected, and therefore that change should go all the way down, right down to the feet of that particular patient. Now, we're not going to be looking at feet today, but I can tell you that we have done studies to show that the leg length in people becomes more equalized when they have the appliance therapy done as well. So that was an example of a younger patient, and you could say, she was going to grow and develop that way anyway, so maybe it's not a good case. So let's look at a slightly older patient. Here's a young guy, and his chief complaint, the parents said, look, his gums are too excessive when he smiles here. And so they took him to our friendly orthodontist, and he actually, put the braces on like they typically do. But the gummy smile didn't go away. And so the parents said, is there something else we could do? And we worked closely with the orthodontist saying, let's do a little experiment here to say, what would happen if we took the braces off and put the DNA appliance there? And let's just try to see what happens. If it doesn't work, we put the braces back on. Well, what happened in a period of about a month is that the gummy smile became resolved. And what that means is it's not so much about straightening the teeth, but the underlying bone here has been remodeled, and so the gums are now kind of hiding behind the upper lip when he smiles instead of being excessive, and that allows the bottom jaw to come further forwards, and so he gets a slightly better facial profile. Now, you could say, well, you got lucky on that first case, and he was going to grow that way anyway. So let's do another case. And so here's another young guy, independently done, no history of braces. But again, the major concern of the parents was that he's got the kind of smile, and when he smiles, he's got kind of a lot of gum tissue showing. And so, again, we used a lower appliance, an upper appliance, should I say, in this child, and he wore it for about 4 weeks. And what the parents said is when he came back, what we found is that the gummy smile has been reduced. When he's smiling, he's not showing so much gum tissue, and the lower jaw is starting to come forward. So we see it, from time to time that we can reduce these gummy smiles in patients who don't like that type of appearance. Here's a different case, and in this case, the major concern was that the teeth were crooked. And again, this is a younger child, and the main concern here was that there may be insufficient space, and so the parents' fear was that teeth might be taken out whilst this patient is, getting typical orthodontic treatment. So the option that was put forward was, well, let's see if we can redevelop that jaw using an upper appliance to see if we can shrink those teeth out without braces and wearing the appliance late afternoon, early evening, and all night. So no one needs to know that this child is having treatment done. The child will finish school, puts the appliance in, wears it in the afternoon and the early evening, takes the appliance out when they're having their evening meal, brushes the teeth, cleans the appliance, puts it back in, and wears it all night long. So 12, 14, 16 hours of wear, one for the top and one for the bottom jaw. In the period of about 2 years, you can see that those teeth are pretty much straightened out and no braces were worn. No one needed to know that that child was wearing an appliance to have the teeth straightened out. And, of course, what we want to encourage is a tongue. You see, the tongue is down here between the teeth, and it's kind of further back here. We encourage the tongue to be sitting up on the palate here, and that will prevent any relapse from occurring. It'll prevent the teeth from moving back at a later point.